Question 1. Why is it essential for surgical personnel to maintain all components of a multi-part instrument set together within the procedural area immediately after use? A. It ensures the immediate availability of replacement parts for concurrent surgeries in adjacent rooms. B. It allows the environmental services team to process and turn over the operating room significantly faster. C. It eliminates the regulatory requirement for the sterile processing staff to perform a post-decontamination inventory check. D. It prevents the misplacement or loss of critical components and avoids severe delays during the reassembly phase. Correct answer D. Knowledge point explanation. Core rationale. Keeping all parts of an instrument set together from the point of use is a foundational best practice for asset management. It prevents small screws, distinct attachments, or matched parts from being separated, which directly prevents delays and losses when the set is processed and reassembled in the sterile processing (SP) department. Trap analysis. Option A is incorrect because components of a soiled set cannot be used as replacements for other sterile sets. Option B is incorrect as environmental services clean the room surfaces, not the surgical instruments. Option C is false. SP technicians must always perform rigorous inventory checks regardless of how the instruments arrive. Concept extension. Proper containment at the point of use is POU, also protects multi-part instruments from mechanical damage during transport. Question 2. If contaminated medical devices cannot be immediately retrieved by the SP department, where must the user unit temporarily store these soiled items to comply with safety regulations? A. Submerged in a 3-gallon basin of sterile water at the patient's bedside until pickup. B. In a specifically designated holding area that is clearly labeled for biohazardous materials. C. Inside an active clean supply closet on the bottom shelf to keep them out of public view. D. Locked securely inside the nursing station's medication preparation room. Correct answer B. Knowledge point explanation. Core rationale. To strictly prevent cross-contamination and ensure environmental safety, any soiled items held in user units must be contained in a designated holding area. This area must be physically separated from clean supplies and clearly marked with biohazard signage to alert all personnel of the infectious risks. Trap analysis. Option A is extremely dangerous. Leaving soiled items at the bedside exposes patients and staff to severe infection risks and violates containment rules. Option C is a gross violation. Clean and dirty items must never share the same storage space. Option D is incorrect because medication rooms require strict aseptic conditions and cannot house biohazardous waste. Concept extension. The Occupational Safety and Health Administration, OSHA, enforces strict guidelines regarding the labeling and segregation of biohazardous materials in healthcare facilities. Question 3. An operating room educator is teaching new nurses about the importance of treating instruments immediately after a procedure. Which of the following is not considered a primary objective of performing POU treatment? A. Minimizing the daily workload and staffing requirements for the decontamination area. B. Preventing the adhesion and formation of dangerous microbial biofilms on stainless steel. C. Extending the functional lifespan of the surgical assets by removing corrosive blood. D. Facilitating easier mechanical cleaning by preventing biological soil from drying. Correct answer A. Knowledge point explanation. Core rationale. While effective POU treatment inherently makes the subsequent decontamination process smoother, reducing the workload of the SP department is a secondary operational benefit, not the primary scientific or clinical goal. The actual objectives are rooted in patient safety, infection control, and asset preservation. Trap analysis. Options B, C, and D represent the true core objectives of POU treatment. Removing gross soil prevents biofilm, retaining moisture prevents soil from hardening, and removing blood stops chloride-induced pitting, all of which are essential for successful sterilization and instrument longevity. Concept extension. The phrase "if it's not clean" it can't be sterile underscores why POU treatment is critical. Sterilants cannot penetrate dried organic soil. Question 4. A transporter is moving biohazardous materials from the surgical suite to the SP department. What is their ultimate priority and goal during this transport process? A. Ensuring the case cart reaches the decontamination area in under 10 minutes to halt bacteria. B. Strictly minimizing the risk of cross-contamination to patients, staff, and the facility environment. C. Applying a high-level disinfectant to the instruments while the cart is in motion. D. Sterilizing the external surfaces of the transport cart before it enters the designated elevator. Correct answer B. Knowledge point explanation. Core rationale. The absolute highest priority when transporting soiled items is containment to prevent cross-contamination. Utilizing closed, solid-bottom carts ensures that microorganisms, blood-borne pathogens, and potential fluid leaks are kept entirely within the cart, safeguarding the external environment and any personnel encountered along the route. Trap analysis. Option A is incorrect because while prompt transport is good, there is no strict 10-minute rule that halts bacteria. Containment is the primary goal. Option C is false. Processing never occurs during transit. Option D is incorrect. Carts are wiped down or cart washed after use, but the exterior is not sterilized prior to entering an elevator. Concept extension. Transport routes should be pre-planned to avoid high-traffic public areas, such as cafeterias and visitor lobbies, further minimizing exposure risks. Question 5. Prior to manually transporting a heavy, fully enclosed case cart loaded with 150 pounds of soiled instruments, an SP technician must primarily be mindful of what specific occupational safety factor? A. The proper ergonomic principles of pushing, pulling, and lifting to prevent physical injury. B. The precise surgical procedure names that generated the soiled instruments inside the cart. C. The daily visitation schedule of the hospital to avoid maneuvering through crowded hallways. D. The current inventory levels of enzymatic detergents available in the decontamination sink. Correct answer A. Knowledge point explanation. Core rationale. Moving heavy case carts introduces significant physical strain. Technicians must strictly apply proper ergonomic principles, such as pushing rather than pulling, maintaining a straight back, and using leg strength, to prevent devastating musculoskeletal disorders, MSDs, related to the spine, joints, and muscles. Trap analysis. Option B is irrelevant to the physical safety of transporting the cart. Option C is a logistical and courtesy consideration, but it does not address the direct physical safety mechanism required to move 150 pounds. Option D is a workflow concern for the decontamination area, not a pre-transport safety factor for the worker's body. Concept extension. Musculoskeletal disorders, MSDs, are among the most common workplace injuries in sterile processing due to the continuous handling of heavy trays and carts. Question 6. A dental clinic needs to send contaminated instruments across town to the main hospital's sterile processing, SP, department. According to the Department of Transportation, DOT, and internal facility policies, what is the most fundamental principle that must be defined and strictly maintained during this off-site transfer? A. The precise level of biological soil acceptable on each tool. B. The exact shade of fluorescent orange for the biohazard signage. C. The complete physical separation of clean and dirty items. D. The specific enzymatic foaming agent used for biofilm removal. Correct answer C. Knowledge point explanation. Core rationale. The most fundamental principle of any transport policy, especially for off-site transportation over public roadways governed by the DOT, is ensuring that clean and sterile items are never mixed with contaminated items. Their pathways and storage areas within the transport vehicle must be clearly defined and physically separated to prevent cross-contamination. Trap analysis. Option A is incorrect because all soiled items are treated as equally hazardous regardless of the level of soil. Option B is a labeling requirement, but the principle of separation is far more fundamental to infection control. Option D is related to point of use, POU, treatment, not the logistical transport policy itself. Concept extension. Off-site transport vehicles must also carry an Environmental Protection Agency, EPA, registered disinfectant spill kit to handle potential accidents during transit. Question 7. A clinical educator is auditing the operating room's point of use, POU, practices. Which of the following observed actions or logistical targets is actually not a direct goal of the POU treatment itself? A. Wiping away heavy gross soil from the surgical instruments. B. Containing the biohazardous items to prevent cross-contamination. C. Transporting the items to decontamination within exactly 2 hours of the procedure's end. D. Arranging delicate instruments carefully to prevent damage during transport. Correct answer C. Knowledge point explanation. Core rationale. While prompt transport is an important logistical requirement that follows a surgical procedure, dictating a specific time frame like within 2 hours is not a functional goal of the physical POU treatment. The actual goals of the treatment focus directly on the instruments, removing soil, preventing damage, and containing the biohazard. Trap analysis. Options A, B, and D are the primary, direct goals of POU treatment. Removing gross soil directly prevents biofilm formation, containing items directly protects staff, and arranging items directly protects the hospital's expensive assets from breakage. Concept extension. Delaying transport allows organic soil to dry, which exponentially increases the time and chemical action required during manual cleaning in the SP department. Question 8. A hospital is designing a new vertical transport system for moving contaminated surgical sets from the third-floor operating room down to the first-floor decontamination area. What is the absolute best and safest practice for this specific transport route? A. Utilizing an open-wire case cart during low-traffic evening hours. B. Constructing and utilizing a dedicated soiled elevator exclusively for biohazardous transport. C. Using a covered cart in a shared patient elevator when no visitors are present. D. Maneuvering the closed carts through the main, high-traffic service elevator. Correct answer B. Knowledge point explanation. Core rationale. The premier standard for infection control during vertical transport is the use of a dedicated soiled elevator. This physically isolates the contaminated carts from clean supplies, hospital staff, patients, and visitors, ensuring complete vertical separation and drastically minimizing the risk of airborne transmission or spill exposure in confined elevator spaces. Trap analysis. Option A is an Occupational Safety and Health Administration, OSHA, violation. Open carts cannot be used for soiled transport. Option C is risky. Even if visitors aren't present, sharing an elevator with patient routes risks environmental contamination. Option D is poor practice. High traffic areas increase the statistical probability of an accidental collision or exposure incident. Concept extension. If a dedicated elevator is structurally impossible, the facility must have strict, written policies defining designated times and terminal cleaning protocols for shared elevators used for soiled transport. Question 9. During a long orthopedic case, the surgical scrub technician needs to keep several stainless steel bone rongeurs moist to prevent blood from drying. Which of the following actions is strictly prohibited during this point of use, POU, treatment? A. Opening all box locks and hinges before placing them in the transport bin. B. Disassembling the multi-part instruments according to the manufacturer's instructions. C. Placing the instruments in a basin filled with standard 0.9% saline solution. D. Arranging the heavy instruments in an orderly manner at the bottom of the tray. Correct answer C. Knowledge point explanation. Core rationale. Exposing surgical instruments to saline, salt water, is strictly forbidden. The chloride ions in saline rapidly attack the protective chromium oxide layer, passivation layer, of stainless steel. Prolonged exposure causes irreversible corrosion, rust, and pitting. Instruments must only be kept moist with sterile water or approved enzymatic foams. Trap analysis, options A, B, and D are all mandatory best practices during POU treatment. Opening hinges and disassembling parts ensures cleaning chemicals can reach all surfaces later. Arranging heavy items at the bottom prevents the crushing of delicate instruments. Concept extension. Pitting provides microscopic crevices where bacteria can hide and survive the sterilization process, rendering the instrument biologically unsafe for future use. Question 10. A sterile processing technician has been manually lifting heavy, 25-pound instrument trays and pushing poorly maintained case carts for several months. They begin to develop chronic pain, numbness, and limited mobility in their wrists and lower back. What is the comprehensive medical term for these types of injuries involving muscles, nerves, tendons, or joints? A. Generalized occupational pain points. B. Musculoskeletal disorders, MSDs. C. Undefined workplace stress disorders. D. Acute ergonomic physical injuries. Correct answer B. Knowledge point explanation. Core rationale, musculoskeletal disorder, MSD, is the precise, overarching medical and occupational safety term used to describe injuries and disorders that affect the human body's movement or musculoskeletal system, muscles, tendons, ligaments, nerves, discs, etc. These are frequently caused by repetitive motion, forceful exertion, and awkward postures common in SP work. Trap analysis, option A uses non-medical, colloquial terminology, pain points. Option C is too broad and implies psychological or generalized stress rather than specific physical tissue damage. Option D is incorrect because an ergonomic injury is a casual descriptor for a subset of MSDs, and the prompt asks for the comprehensive medical term for the general condition. Concept extension. Proper training in body mechanics and the use of adjustable height sinks are critical administrative and engineering controls used to mitigate the risk of MSDs in the decontamination area.